What are investors looking for in small cap biotech names, based on your conversations?
Yeah, mainly they're looking for upside. They're looking to get involved with companies in early stages who've had their stock under pressure and therefore undervalued. They're looking for companies who have solid technology and a clear path to get through the FDA and into commercialization.
One of the most difficult parts of the life sciences space is getting through the regulatory process. And during COVID, the FDA's attentions were focused on COVID, taking resources away from drug development in other areas. And I wonder if your sense is that things have changed. I know that it was very hard to get meetings and get approvals and things like that back about a year or two ago. Have things improved since then? Has communication with the FDA loosened up?
Yeah, things have significantly improved since the pandemic, when they weren't even reviewing applications. So the communication times have gotten shorter, and they've gotten a lot more, I would say, comprehensive. So there's less back and forth between companies and the FDA right now.
Very good. And the Symphony device is really impressive. And as I thought more and more about it, I used to be in the Navy, and I was on a ship, and the Navy also has aircraft carriers, so there's 6,000+ people on them, and they need tests like this, but they probably can't have a reference lab on them. And also these ships are way out at sea. You also have forward deployed forces. You have rural hospitals, kind of all these areas that are kind of separated from where the big reference lab would be. Are these all appropriate for the IL-6 test? And kind of how do you think about end markets for the product when you expand beyond just the emergency room, LTAC, and some of these other areas that we talked about earlier?
Yeah. So first of all, John, thank you for your service. And your experience in the Navy does highlight one potential application for the Symphony IL-6. As you know, Symphony is small and easy to maintain, easy to support from both personnel and cost perspective. So in these applications that don't have high patient volume, so that we're talking lower patient volumes here, because you're talking about applications where people are mostly healthy, so you hope they're mostly healthy most of the time. And also in places like on ships or whatever it may be that the Navy would have, where space is a premium, a system like this could have a significant benefit to those the men and women aboard our ships. And so military transport, disaster situations are places where the Symphony could really,
Right.
really shine.
And I think another element that we didn't really talk about is that I think it has its own power supply. Is that right? So when you talk about emergency situations, I think maybe a hurricane or some kind of other, like an earthquake. I know there's been some earthquakes recently. This might be the perfect device to use in those areas where you don't have a steady power supply.
It could be. So right now it is it's basically optimized for hospital use where there's always power available.
Hmm.
After it's been validated, it can be deployed onto a cart potentially, and that has battery packs. However, because it's small and it doesn't require much energy, it'd be very trivial to add a battery pack to this, so you can carry it around if needed be, if you needed to.
Okay. Yeah, it sounds like in emergency situations or crisis situations, this would probably be a really important thing. And, that kind of brings me to my next question. As I was reading through, there's always legislation proposed in Congress. Doesn't always get through, but there was something I saw recently on increasing the diagnostic testing preparedness in case of public emergencies. Is there a place for Symphony in this proposed legislation?
Yeah, we believe there is. So from what we can tell, this bill has been proposed focuses on the development of diagnostics for novel threats and infectious diseases. So the bill does state that it involves working with diagnostic manufacturers like Bluejay to have devices that can be widely deployed in the event of crisis. This would be one potential application for Symphony, and that can be used as a rapid response tool in the event of a new threat or disease.
Another area that I was thinking of that might be appropriate for the Symphony system is stroke. I kind of think of that as heart or chest pain. You need to right away diagnose it and get it right? Because as you said, time is muscle or time is brain, or depending on where where the issue is. Is there an opportunity for this in stroke? Is there a test that might be leveraged here?
Yeah, so there have been lots of studies performed on traumatic brain injury, so past stroke, and they've shown a strong correlation between IL-6 and brain injury. There's a much more recent set of studies that have looked at IL-6 and the onset of stroke. And so they're trying to correlate IL-6 and using it as a monitoring tool for how soon the stroke has happened. And so why this is important is for the administration of potential life-saving drugs. So one specific drug is called TPA, which is basically a clot buster used in ischemic stroke. And there's a clear delineation at 4 hours. So if you give it before 4 hours, there's much better outcomes than if you do it after 4 hours.
So there's much broader applications here, and another area, oncology is always a big area. I don't know if there's any applications here, but is there a place for rapid turnaround tests in oncology?
Yeah, so there's definitely critical care situations for cancer patients. So there are potentials in treatment guidance, like for example, in a surgery when you're trying to do a resection and you have, say, a cancer that secretes some biomarker into the bloodstream or into another fluid. This is where you can use Symphony to determine if you've gotten all the cancer or not by simply looking at the levels and seeing if they go down to a normal level.
Great. Well, thank you, Dr. Cook. Really appreciate you joining me here today on Unboxing Biotech to talk more about the company, and thank you so much.